Assalamu alaikum and a very good evening. I'm Dr. Shaista Kawal. I'm working as Assistant Professor of Endocrinology at Hayatabad Medical Complex, Peshawar. On behalf of the Pakistan Endocrine Society, it is my great pleasure to welcome all distinguished guests, respected faculty members, chairpersons, speakers, and delegates and our industry partners to the 12th Midsummer Endocrine Updates here at the beautiful PC Bourbon. This conference brings together leading experts and healthcare professionals from across Pakistan to share knowledge, exchange ideas, and discuss the latest advances in endocrinology and metabolic medicine. The theme of this year's conference, Advancing Endocrine Care, Bridging Science and Practice, reflects our collective commitment to translating emerging evidence into better patient care and improved clinical outcomes. Over the next 3 days, we look forward to various scientific discussions, valuable learning opportunities, and meaningful professional networking. It is now my great honor and privilege to invite the President of Pakistan Endocrine Society, Professor Dr. Ali Asghar, to deliver the presidential address.
Bismillahirrahmanirrahim. Assalamu alaikum, everybody. Thank you very much, first of all, for coming to this 12th Midsummer Endocrine Updates Conference. It's a pleasure and an honor to have you here. Allah Almighty says in the Holy Quran, and whoever saves the life of one person, it is as if he has saved the whole of mankind. And this is the crux of medical practice that we go through day in and day out. So before I begin, I would like to thank all the founding members of Pakistan Endocrine Society. And some of these brilliant personalities sit amongst us today as well. Please give them a very warm clap, please. And as I move forward, I would also like to thank all the past presidents and their board of managements for taking Pakistan Endocrine Society to the level that it stands today. Please give a very warm clap to the brilliant personalities. So moving forward, Pakistan Endocrine Society has 3 goals: to increase our local penetration, both in terms of improving the practices of medical practitioners in endocrine and diabetes, as well as increasing the awareness of diabetes and endocrine disorders amongst the masses; to increase our regional and international collaboration, which in turn will help our endocrine fraternity and help advance the care of endocrine disorders and diabetes in Pakistan; and capacity building of our own endocrinologists, which will secure a bright future of endocrinology in Pakistan. So, starting from where Dr. Aisha left her last speech, she was the immediate past president and worked very hard. This was the annual conference in Karachi last year, and we had more than 2,300 participants in the annual conference, which was a record for Pakistan Endocrine Society. Thank you very much for attending that conference as well. So as myself and the new board of management took reins in January, we had a lot of things that were done, and I would just give a brief overview as to what we did. This was diabetes and Mahe Ramazan activities. So there were a lot of CMEs done in Peshawar, Mardan, Sawat, Islamabad, Karachi, Sawabi, Abbottabad, Gujranwala, Kohat. And I really thank all our executive and scientific executive members for coming forward and doing all these CMEs to uplift the knowledge of practitioners in these cities. And thank you very much to my vice presidents who have worked very hard to get these CMEs going. We also did radio programs in different provinces. These were the radio programs done in KPK on diabetes and Ramazan. So these were the programs in Sindh. These were the radio programs in KPK. And these were the radio programs done in the province of Punjab. So again, all these radio programs, not only that they were done on FM and people could listen at that time, but the recordings of these programs were also posted on our social media so that people can take benefit of these programs even later on when they have time. We also made a lot of awareness videos, 28 awareness videos on Ramazan and diabetes. Thank you very much to our Vice President Sumaira Batul, who worked hard on this with other executive and scientific executive members to prepare these 28 videos on Ramadan and diabetes so that people can take a benefit out of this and people with diabetes can fast effectively and smoothly in Ramadan. There were a lot of social media messages as well concerning the diet, concerning the myths of Ramadan and diabetes, and all these social media messages are always helpful to the patients. This was the Ramadan and diabetes talk show that we had on social media, and we realized that this is the modern age of social media, and people are very glued to social media. So we try and do more things on social media. So this was the public awareness session done on social media. Again, thank you to Dr. Oniba Sayyed for taking this lead. On the occasion of World Thyroid Day, which was on 25th May, we did 18 CMEs across Pakistan in the 2 months of May and June. And I'm again very grateful to all our members for taking the aggressive lead to do these CMEs across Pakistan. So this was the Thyroid Symposium in Capital Hospital, Islamabad. Thank you very much, Dr. Sarwar Malik, for leading this program. This was the World Thyroid Day in Karachi, National Institute of Diabetes and Endocrinology. And thank you to Dr. Musarrat Riaz for organizing this. This was the World Thyroid Day CME in Sir Syed Medical College, Karachi. Thank you very much, Professor Zaman Sheikh. You've always worked hard for the society since I've seen. And this was Thyroid Dilemmas Decoded at Jinnah Postgraduate Medical Center, Karachi. Thank you very much, Dr. Uruj Lal Rahman and Dr. Fatima Zehra for organizing this. Another World Thyroid Day CME was held in Karachi, organized by Dr. Sumaira Batul and our immediate past president, Dr. Aisha Sheikh, for working on this. More academic sessions were held on thyroid disorders at Hayatabad Medical Complex, Peshawar. Thank you very much, Dr. Tahir Ghaffar and Dr. Mujibur Rahman for organizing this. We also had CMEs in far-flung areas, District Headquarter Hospital in Landi Kotal, Khyber Agency, and then a symposium at Khyber Teaching Hospital, Peshawar as well. We also had Thyroid Symposium at Northwest General Hospital and Research Center, Peshawar. Thank you very much, Dr. Arshad Hussain, for organizing this. And another Thyroid Symposium at Khyber Medical University Hospital and Research Center, Peshawar. Thank you very much to the organizers and Dr. Khalid Usman. We had two thyroid CMEs in Sawat, one at Sedu Medical College, organized by Dr. Yaqub Khan, and the other one at Sawat Medical Complex, organized by Dr. Sardar Ali Khan. There was also a thyroid symposium held at Mardan Medical Complex by Dr. Asadullah and a CME in Timargara, Lower Dir. There was also a CME in Bannu Khalifa Gul Nawaz Hospital. So all in all, I think together we can move forward. And I was literally very pleased that the members, they came forward, held these CME activities in their institutions on thyroid disorders, which is sometimes just gets left behind actually. So again, radio programs, there were 8 radio programs on 25th May from 8 different cities of Pakistan on different channels. Some were in Urdu language, others were in regional language, so that the people can have more knowledge of thyroid disorders and look more into this. Again, these programs, they were saved, they were recorded, they were then played on the social media so that people can benefit more out of these. We also had a webinar on approach to thyroid dysfunction. Thank you very much, Dr. Oniba Sayyed, for leading this webinar, and thanks to our lovely members for being part of this. We had 2 public awareness sessions on social media led by Dr. Saima Asghari on thyroid disorders. And we also had a regional thyroid dialogue where we invited Nepal, Bangladesh, and India. And it was interestingly done mostly in Urdu language. And it was very good because regional interaction brought new aspects of thyroid disease management in this part of the world. And again, the video messages that were circulated on social media on thyroid. Then it was Hajj and diabetes, again something that people with diabetes are very worried about, whether they can go on Hajj and how they would be sparing time there. So we did a social media program on Hajj and diabetes led by Dr. Saima Asghari. Then there are a lot of social media messages that we continue to bring onto our social media to give awareness about Hajj and diabetes. And I must say, Dr. Ibrar Ahmed is is with us here today, and he is the one who is leading the social media campaign in endocrine and diabetes for Pakistan Endocrine Society. Coming up to obesity, so we have got some nice kid as a chair. So there was no chair in my talk, so now there is a chair, right? So that's nice. Things are moving fast from social media to young chairs. Things can happen dramatically, right? So obesity awareness sessions. मेरी घंटी तो जल्दी बजा दिया आपने. Obesity awareness sessions. So again, we had social media program on obesity, and Dr. Wasfa Ejaz was the moderator and wonderfully led by our team. Then again, a lot of messages on social media on obesity to bring the awareness amongst the people. And these are all the social media messages that are there. We have also launched a video awareness campaign on obesity, and all these videos have been prepared and they'll be circulated on social media in the month of July and August. So again, many endocrine and diabetes awareness social media messages have been floating for the awareness of general public on thyroid, on glucose monitoring, and other aspects of endocrine and diabetes. So having said that, coming on to the international collaborations of Pakistan Endocrine Society. Now this was in Feb 2026 when Pakistan Endocrine Society collaborated with Emirates Diabetes and Endocrine Society. And this was the Emirates Diabetes and Endocrine Congress, where we had a joint symposium with the EDAC. And thank you very much to Dr. Abbas Raza for bringing us to the international forums. Pakistan Endocrine Society has also joined the Federation of Endocrine Societies of Asia and Oceania. Thank you very much, Dr. Aisha Sheikh, for your efforts to bring us into the FISAO. And in fact, this is on the left, you can see the Pakistan Endocrine Society stall at the AOCE with the President-elect of ICE actually visiting our stall. And here is Dr. Abbas Raza being the speaker. And this is the FISAO Council meeting where I, along with Dr. Abbas Raza and Professor Saeed Meher, actually chaired the meeting in FISAO. You can take the chair position, but don't ring the bell. So Pakistan Endocrine Society at 2nd International Obesity Congress, South Asian Obesity Forum, a huge participation by Pakistan Endocrine Society here. A lot of our executive members and scientific executive members were part of the International Obesity Congress. And we see there was a textbook of obesity that was also released in this Congress. And there was also launch of the CEPHES guidelines on hypo and hyperthyroidism in the South Asian Obesity Congress. Pakistan Endocrine Society also participated in International Congress of Endocrinology in Japan. Our very own Dr. Abbas Raza, who is also the past president of PES, past president of CEPHES, and yes, he is the brilliant person, you are right. Who's the past president of PES, who's the past president of CEPHES, and also the past president of International Society of Endocrinology. He was the co-chair, organizing co-chair of the International Society of Endocrinology, and in fact invited the world in general and Pakistan as well. So here we see the participation. Dr. Abbas Raza was speaker at the International Congress of Endocrinology. And we also see Professor A.H. Amir and Dr. Aisha Sheikh chairing this session in CEPHES in Japan, ICE. Pakistan Endocrine Society is also a part of CEPHES, of course, and we regularly take part in CEPHES Endocrine Clinics 2026. So again, coming up to some more aspects, the Journal of Pakistan Endocrine Society. Pakistan Endocrine Society has a 6-monthly journal coming in, and I request you all to send your articles and case reports and editorials in the Journal of Pakistan Endocrine Society. This is the REACH program. We have got 3 REACH programs. The 4th one, in fact, is also open now, where screening of diabetic patients are regularly held. We have a center in Timargara. We have a center in Mohib and Bakshali camp as well. So again, this was a new project, EndoBuzz. This was the brainchild of Dr. Tahir Ghaffar, a buzzer quiz competition amongst endocrine fellows. We already had sessions in Peshawar, Islamabad, Lahore, Karachi, and the grand final will be held on Sunday, 5th July. So do attend that. That's going to be pretty exciting as well. We also started Endocrine Monthly Roundup, which is started by Dr. Tajammul. He's working on this, and every month we release a document which has the latest research in endocrine and diabetes of the preceding month. So in just 2-3 pages, you can just go through whatever happened new in endocrine and diabetes in the last month. This is available on our website, and it's also sent to all members on email. We have also started Hormone Talks, which is a weekly radio program of Pakistan Endocrine Society. Every Thursday, 2 o'clock on FM 100, we have the radio program of PES. And these programs are also recorded, and sometimes they are relayed live on our social media as well. The Endo Hub 2026 is a wonderful program where our fellows, they present cases, and the best presenters, they win and move forward. The first session of the Endo Hub is coming up on this Sunday early morning, 8:45 a.m. Dr. Gohar Khan is wonderfully leading the project with his team, and I'm very excited to be part of this. So coming up next, inshallah, is the Endo-Lectual. This is a poster presentation competition, and this will involve the endocrine fellows as well as the medicine residents. Dr. Musarrat Riaz is taking care of the project. The last date is 8th August. This is not yet released, and you'll see it coming up on the social media in the next week. We are also launching, and this project is very close to my heart, Endo Hour. So there was also always a request from general practitioners and physicians that we want sessions to be held that we can see at our home only. So this project is basically a case-based approach to endocrinology and diabetes for general practitioners and physicians on first and third Sunday of every month. And you just sit at home and see the program on Zoom from 11 to 12 in the morning. And this is known as Endo Hour. Dr. Uruj Lal Rahman will be looking after this program. Thank you very much, Dr. Uruj. This is starting from 2nd August. Some more important projects that I need to tell you: free medications for patients with type 2 diabetes. I think now PAS is in a position, because we're doing a lot of things for public awareness, for general practitioner education, and uplifting of our own endocrinologists. We need to move a step forward now. So free medications for patients with type 2 diabetes. I know this is an ambitious project, but PAS wants to start this and help poor people who cannot buy medications to get medications. And I'm thankful to my board of management who gave approval right in the first month of the tenure. So we have the directors, Dr. Zakir Alvi, Dr. Ibrar Ahmed, Dr. A.H. Amir, and Dr. Ali Java, with project lead being Dr. Faisal Qureshi. And I'm thankful to you all. And we'll be starting from maybe 2 or 3 centers and then gradually moving forward. And I'm sure, inshallah, this will serve to help people who cannot buy medications for type 2 diabetes. You all know there are certain endocrine medications that are not available in Pakistan, and we have been discussing it for a long time, right? Pakistan Endocrine Society has been doing a lot of advocacy in this. I remember Dr. Ibrar's tenure, Dr. Aisha's tenure. You had been working hard, talking to the industry, and advocacy is ongoing, of course, and we are very happy that some medications like Cabergoline is now available, and we are very actively engaging with the industry to persuade them to bring more of these medications which are not available in Pakistan. And in fact, tomorrow we have a meeting with the industry, and again, one of the biggest points that we have to discuss is this: the medications that we don't have, endocrine related medications that we don't have in Pakistan, we want that here. This is again something, a long prevention project, Har Zila Sehat, Har School, Har Masjid, Har Zila. So what we are doing it, we have 170 districts in Pakistan, and I think with being on number 3 in the world in diabetes, I don't think so there is more space to go up with the highest prevalence already there. So we want to go in every district of Pakistan, and what the model that we have prepared is that we will be interacting with the general practitioners and physicians, or jo area mein jo doctors baithe hain, we'll be getting in touch with them, and we'll be requesting them just one thing: to please go to just one school and one masjid in your area and be associated with PAS. Come close to PAS and get associated with PAS. So this we are starting 170 districts. The plan is finalized, inshallah, and we'll be starting this project from August. And I'll be needing support of all of you in this project, because if one general practitioner and one general practitioner just goes back to one school and one masjid, we can cover a lot of Pakistan through this. And it's the next generation, the schools we are targeting, because it's the next generation that we need to focus on. Advocacy is the way forward, and we are now moving towards advocacy. There are a lot of things that need to be taken to the government level to move faster, and we in principle have agreed to move into that direction, and inshallah in the next few months we'll be moving on to that. This is our newsletter, which comes up every 3 monthly, shows the activities of Pakistan Endocrine Society, led by wonderful editor-in-chief Dr. Saima Asghari, and our esteemed members from all 4 provinces. Pakistan Endocrine Society has got a lot of publications. We have publications on thyroid and endocrine tests and PEMOS and our own journal and newsletter. To stay connected with Pakistan Endocrine Society, you can log on to our website, access the clinical guidelines, newsletters, publications, the journal, and update your knowledge accordingly. But that is not enough. Join us and become a member of Pakistan Endocrine Society. We have got a lot of membership categories. Just log on to the website, see which membership category you fit into, and apply and join hands together, especially in the wake of the projects that are coming forward. In the end, special thanks to all our esteemed members and all the participants whom I see here. Special thanks to my lovely board of management. You guys work very hard, and it's nothing is possible because of your hard work. Special thanks to our national coordinator Harun Michael, Atif, Jamal, and Anas. You guys work hard but never get the spotlight on the stage. Thank you very much to all our corporate members for supporting our projects. And before I leave the podium, I invite you all to the annual conference of Pakistan Endocrine Society in Islamabad, 9 to 11 October 2026. With this, thank you very much to you all, and thank you very much to the young chair who took part of the stage with me. Thank you very much.